You.
We are now recording, so don't say anything bad about me while we're recording, okay? Okay, everybody. Well, what we're going to be talking about today is operational planning. So we're going to talk about all the different levels of the operational plan. Going to go through some real live examples from public health of the different levels. And then at the end, we're actually going to go in and enter an operational plan into the system so you can see all the steps to go through to do that. So let's go ahead and get started here. First of all, we're going to go past the horse once again. The horse has always got to be there, by the way. And the planning model. So let's go ahead and review the planning model. The top end of the pyramid is your organization. So there's typically just one organization, your health department. Underneath that is the groups in your health department. So groups are typically divisions, offices, programs, and primary plans. So what FAB calls the six-pack of plans, these plans up here in the bubbles are the primary plans typically, and you can have any of them that you want in there, but typically they're independent groups. So let's go take a look at your groups screen here. So your group screen is pretty simplified here. You got Health and Human Services, then underneath that you have Public Health, and you can see the levels over here. Under Public Health, you have the FAB six-pack of plans here, and then we have an accreditation group. Under the accreditation group, we have the FAB operational plan down here. And you'll see that I added these two little groups down here. The training group, if you'll notice, it's actually reporting to itself, and it's a level 1. So it's kind of out of the mix of everything else. So it's just a sandbox to play in. And then the Tobacco 2023 group, we're going to go ahead and use the same plan we did for the introduction training, the tobacco cessation plan, when we actually go enter it in the system here. So this is your group screen, and I'm assuming over time you're going to add some of your other divisions, offices, and programs in there. Underneath the groups, then, you have a set of services or initiatives. Services are ongoing things. I use the example of WIC. WIC has been around forever, will continue to be around, so it's a service. An initiative is something that you're planning on doing in the future. The difference is very simple. You mark it one as an initiative, and typically initiative dates are future dates versus current dates in there. We're going to be talking about tobacco cessation again today. We're going to call that an initiative. Each service or initiative then, as we get down to the actual plan, has a set of goals. Goals are a high-level description of what we're trying to accomplish. Each goal has a set of objectives. Oops, sorry, got too far ahead here. Each goal has a set of SMART objectives. So we're thinking the objectives are the finite target we're setting to get to here. Again, SMART meaning specific, measurable, attainable, realistic, and time-based. And I know there's several different versions of that as well. And then the activities are the steps you're going to go through in order to get to the objective here. So this is the planning model. And what we're going to do first is go through and look at the different nomenclatures here. So this is fairly standard. You'll find this probably, I don't know, 75% of the time you'll see the nomenclature like it is here. But we've seen a lot of different plans from different people that have all these things kind of mixed up. So what I wanted to do is just go through and review some of those so you can see that there are potentials for different names at these different levels, but we're going to talk about how to recognize the different levels regardless of what the names are. So let's look at some of those. Here's the first one, strategic priorities at the top level that we call services or initiatives, goals, strategies for objectives, which I don't buy into that one. Strategies are how we get to something, and I guess you could say it's how we get to the goals, but I prefer strategies at a lower level. One second, please. My computer always wants to talk to me while I'm in the middle of one of these here. And then underneath that, they have objectives where we have activities in there. So the strategic priorities is a very common name for the top end of your strategic plan, but the rest of these are a little bit out of order, I think. Strategic areas, that's a pretty good nomenclature for services or initiatives. Then goals, I like the term outcome objectives. It's what are we trying to accomplish, so the outcome is pretty good. And then strategies, in this case, is how we're going to get to the objective. So that one is pretty solid. Priorities, goals, objectives, and action steps. Pretty good stuff. Action steps is probably the most common name we see for activities. So it is the steps you're going to go through to get to the objective here. Priority areas, goals, again, strategies, I think in the wrong place, but then action steps underneath that. Priorities, goals, objectives, and strategies. That's pretty good. Strategies at the top. Yeah, I don't know if I buy into that or not. Strategic objectives. I like that one because strategic objectives is kind of the bigger picture of the SMART objective. So it probably works. And then objectives and action steps. One of the reasons I give you this is because at some point in time, somebody's going to come to you and say, hey, here's a new operational plan we want to put into VMSG dashboard, and it's going to have mixed up terminology in there. So what we're going to do today is look at the different levels of the pyramid and go through some real life examples from public health so you can kind of get an idea of, if I see this, it's probably a service or initiative. And if I see this, it's probably a goal. So let's go look at, first of all, the groups. So the second level down in the pyramid is the groups. And you saw your group structure, which is fairly common, but hasn't really built out all of the divisions, offices, and programs yet. So here's an example here. The department administration is typically the top level group, and they go levels 1 to 10, by the way. I don't think anybody's ever gotten past 6, to the best of my knowledge. Underneath that, you might have a group called community health. Community health then is a level 2, reporting to the department of level 1. And then potentially under community health, you might have WIC. So WIC is reporting to community health. Community health is then reporting to the department. Now, a lot of departments have WIC reporting directly to the department. So you can make a WIC a level 2 group, and its parent group then would be the department as opposed to community health. So these can be moved all over. By the way, once you get them established, they can all be moved easily as well. And then down here at the level 2, a lot of times you'll have, like you guys do, your 6-pack of plans. So the strategic plan, the CHIP, the CHA, et cetera. So the strategic plan is level 2, reporting up to the department. The CHIP, again, is level 2, reporting up to the department. For today, we're going to use the example of Tobacco 2023 and the tobacco programs as a group. So again, groups can be pretty much anything. It's a little bit nebulous, but typically you start out with the breakout of your department. So divisions, offices, programs. You add in there the strategic plan, your CHIP, your emergency ops and that sort of thing, the FAB 6-pack of plans in there, and then kind of work down from there. Now, underneath the groups then, we have what we call services or initiatives. And these are just some real life examples. So think of these as kind of being placeholders. It's the bucket that the plans are going to be falling into here. It's really not performing an action at this point in time. So here's some examples. Healthy moms and babies. Readiness for emerging health threats. Effective agency processes. Access to care. Behavioral health and substance abuse, population health, organizational excellence, chronic disease prevention and control, health disparities, and for today we're going to use the example of tobacco cessation. So again, look at these and you look at them and it's really kind of a priority, or like I say, it's a bucket that we're going to contain plans in. The plans really, the plan themselves kind of start at the goal level here. So underneath these, you would have a set of goals. Now, goals are a high level definition, not really specific typically, typically an action verb followed by a few words. So again, here's some real examples. Reduce the risk of infectious disease. Promote safe and sanitary food establishments. Support communities in building resiliency. Enhance healthcare through technology. Drive health in all policy agendas. Reduce the risk of vaccine preventable diseases. Promote public health readiness and response. Promote succession planning and career growth. Integrate a data-driven best practices approach. And then for today, we're going to talk about reduce smoking in high schools. So the thing to look at here, if you look at reduce smoking in high schools, it's pretty high level. It gives you an idea of what we're trying to accomplish without saying which high schools. How much are we going to reduce it? When are we going to accomplish this? So that's the typical goals are, again, fairly high level. When we get down to the objectives, what we call SMART objectives, again, that's when we get down to when and where and exactly how much we're going to do. So again, SMART, specific, measurable, attainable, realistic, and time-based. I always look at S, M, and T. I don't look at the attainable and realistic because if they're not attainable or realistic, why in the heck would you go after them? So specific, measurable, and time-based. So think about that as you're looking at these objectives. So our first one, by December 2023, identify 2 or more strategies to collaboratively reduce risky alcohol-related behaviors. So you think about it, December 2023 is our time. Identify 2 or more strategies is specific, and our measurement is 2 or more strategies here. By December 2023, 80% of educators and school staff have been exposed to ACE awareness education. By June 2023, provide 6 training opportunities for first responders who work with individuals in a mental health crisis. By the end of fourth quarter, all programs will have established goals, objectives, and activities to be reported within the VMSG dashboard. And then for today, we're going to use the example of reduce smoking at Wayne High School by 25% by the end of the school year. The thing to take away from the objectives is it's a target. This is exactly what we're trying to accomplish and how we're going to measure it in a given time frame here. Now, to get to the activities is where we get down to kind of where the rubber meets the road, and that is or get to the objectives. The activities are the steps we're going to go through to get there. Activities come in 3 different types in the VMSG dashboard. The most common type of activity we call a project-based activity. When you're thinking of putting an activity in there, think of a project. So in this case, we're going to create training content and materials for students and faculty on the dangers of smoking. That is a project. We're going to have a beginning date, we're going to have an ending date, and we're going to accomplish this project in the middle here. Project-based activities will be probably 85% of what you put in the system as you're going through. It was the original type before we even added the other type of activities in there, and it went for quite a long time. Every activity's got a performance measure, and it's real simple. The performance measure just tells you, how do I know when I've successfully completed the activity? So in this case, again, we're creating the training content. Once we've created the training content, hey, we're done with the activity. We're going to do it in a given time frame. So we've got a beginning date and ending date. And by the way, these can all be edited as you're going through time. So, COVID happens or whatever, you're going to move the dates out. You're going to do team assignments. We'll go through that when we actually enter the plan, and we'll go into that detail. Partner assignments, these are external partners. And our metric or measurement in this case is % complete. So how far along are we in creating the training content? And that's what we're going to keep up in this activity to measure our status. So our second type of activity here, and by the way, this is the least used type because it's very unique. It's repetitive, and it automatically sets the traffic lights for you. So we're going to say provide 9 training sessions each month on the dangers of smoking to students and faculty. So what we're looking at is every month we're going to be measuring a new cycle. We're going to provide 9 each month, and we're going to move the month forward. So that's why the QA activity is least used. It's only when you're doing something repetitive. So in this case, we're going to set the targets for setting the traffic light. In this case, if we do 9 training sessions, the light's going to be green. If we only do 6 or less, and we're just picking these numbers here, if we do 6 or less, the light's going to be red, and in between 7 or 8 would be yellow. So this is, if you want to automatically set the traffic light, so you can just kind of look at the activity, look at the traffic light and say, hey, we're on track because we're green, or we're way behind schedule because we're red, whatever it happens to be. In this case, we don't have an ending date. We have a cycle start date and a frequency. So if we have a cycle start date of May 1, then the ending date would be May 30th. And then the next month, it would move automatically up into June 1, June 30th, July 1, July 31st, et cetera, down here. So we always have a cycle start date and an ending date. So the ending date is calculated automatically based on the frequency. And that frequency, by the way, can be anywhere between weekly and every 5 years. And we'll see that in a few minutes. The performance measure for a QA activity is created for you based on the wizard. And we'll go through that actually. So in this case, it's training sessions provided, measured monthly, green, yellow, and red. And then again, we'll do the team and team lead assignments, external partner assignments. And then our input metric in this case is just going to be how many training sessions did we provide. So whoever's doing the training sessions is going to go in on a regular basis to this activity and put in that we did 9 this month, or we did 6 this month, or whatever it happens to be. The third type of activity and the second most used type of activity is what we call a QM, or quantitative measurement activity. In this case, contact all 20 tobacco vendors within 1 mile of Wayne High School to ensure they're not selling to minors. So in this case, the QM activity is very, very similar to the project-based activity, with the exception that we now have a target number in there. So our target number in this case is 20. So what I can do is say, if we did 10 of the 20 contacts in here, it can calculate for me. It's pretty smart that way. It can say 10 divided by 20, that's 50%. Hey, we're in good shape here. So that's the difference, is the QM activity calculates the output for you here. In this case, we have the same input or beginning and ending date like we do in a project-based activity. Performance measure in this case is created for you because you have enough information to do that. So we're going to say 20 tobacco vendors contacted between May 1 and June 30th. And then again, team assignments, partner assignments. And our metric in this case, as you would expect, is going to be how many vendors did we contact. So those are the three types of activities, and those are the activities that we believe are going to get us to our target at the objective level. Now, on the bottom of each of these screens, you've seen the plan we're going to look at today based on tobacco cessation. What we're going to do now is take that and put it together into a structure so we can look at it. So our group was tobacco programs for 2023. Underneath that, we had several initiatives. We chose tobacco cessation. Under tobacco cessation, we had several goals. We chose reduce smoking in high school. Under reduce smoking in high school, we chose an objective of reduce smoking at Wayne High School by 25% by the end of the school year. Again, our target. And then we got the steps we're going to go through that we believe will get us there. We're going to create training content. We're going to provide the training, and we're going to contact those tobacco vendors. Now, we might also have another goal as we're going down here. Goal 2, reduce smoking in colleges. And then under that, we might have an objective, reduce smoking at Wright State University by 25% by the end of the school year. And then underneath that, you'd have activities that would support that objective. So this is the operational plan, how it rolls out based on everything in the pyramid. What we're going to do now is we're going to go and take a look at the operational plan template. Now, as I may have mentioned before, this template was created by one of our health departments up in Wisconsin. And what they liked about it was that they could go in and create a plan in a Word document. It's just a Word table, basically. Go in and create a plan in a Word document. They could pass it around to their peers. Everybody could have their input on it. And then when they're done, they could go put it into the system. So what we're going to do today is we're actually going to take this template that has the tobacco cessation plan in it, and we're going to enter it into that training group down there so you can see all the steps you have to go through to enter the plan. So let's go to the actual plan itself. Okay, so this is the template. And by the way, the meeting invitation I sent you has this blank template attached. So we'll be talking about homework here in a few minutes that we can use this for. So let's go up here to our template. So look at the definition. It's kind of nice to have these little definitions. It's real simple up here. So our service or initiative. The question here, what bucket of work or priority does this relate to? In this case, it's tobacco cessation. Our first goal, what is your pie in the sky? So the big picture goal, reduce smoking in high schools. Down here, we have our SMART objectives. So specifically, what and when do you hope to accomplish? And again, we have objective 1, reduce smoking at Wayne High School. Objective 2, reduce smoking at Desert Vista High School. Now, underneath this objective, then you can see we have those 3 activities we were talking about. Create the training content, provide 9 training sessions a month, and contact all 20 tobacco vendors. It just happens that each of these activities is a different type of activity. So we're going to go through in detail when we're entering the different variations of the activities. So the first thing we're going to do is we're going to enter the service or initiative. So what I'm going to do is highlight it up here, and you can right click and copy, or probably lots of different ways to do it. I like keyboard shortcuts. So I'm going to use Control C to copy. If you're on a Mac, it's Command C. Then I'm going to go over to my dashboard. I'm going to go down to my tobacco group, and now I'm going to select the services tab. So when I have a group selected in the group screen and I select the services initiatives tab, it's services initiatives for that specific group. So let's go ahead and click on that, and you'll notice there's nothing in there. So I'm going to go down here. I can either click on this big block that blocks me from entering anything, or I can click on the plus button. It's exactly identical. So I'm going to click on that. I'm going to hit Control V as in Victor on my keyboard here to paste it in there. Now, we also have the option at this point to make it an initiative versus the service. So unchecked is a service, checked is an initiative. A couple of things happen. All the reports then say initiative versus service. The VMSG public that we'll talk about in the next training session will have initiative versus service in there. And again, when you get down to the activities, you'll find that the dates are future dates versus current dates. So we're going to go ahead and mark it as an initiative. Every time you make a change down here at the bottom, you're going to save it with the save button here. So now we have it up here. Now down here at the bottom right, you see this hide service. This is an archive feature. So what happens is, let's say we've gone through the tobacco cessation plan for a year. We're kind of done with it for the year, but we want to keep all of our information for historical reference here. So all I have to do is click on this checkbox, hide the service, save it again. And now when I do that, you see it grays out. If you are a normal user, you won't even see this anymore. If you're a manager user or an org admin user, then you'll get to see this and you get to report on it, do all kinds of different things with it. But it just gives you the access to the history in here. For now, I'm going to go ahead and uncheck this since we're just entering the new plan now. Every time you make a change down here in the bottom, you got to go ahead and save it. What it's doing is taking local data, moving it up to the server very efficiently. So under tobacco cessation then, we have a goal. So our first goal here is to reduce smoking in high schools. So I'm going to hit Control-C to copy that. Go back over here. Now I got two ways to get to my goals for this particular service. One is I can just click on the tab up here if I just have one selected. If I had a bunch of these goals down here or a bunch of these services or initiatives down here, and I wanted to be able to select the initiative and go to the goals tab, I can use this drill down arrow over here. So if I do that, it's exactly like selecting the initiative and then going to the goals tab. Saves you one mouse click is all it does here. But if you had a bunch of them down here, sometimes it's easier to do that. So I'm going to go down here and add my new goal. So I'm going to hit Control-V, paste that in there, go ahead and hit save. Now let's go back. I think we had a couple other goals on here. So if I scroll down, there we go. So we have reduce smoking in colleges. Control-C, I'll go back over here. This time I'm going to hit the plus button to add the new one. Control-V, save that. I think we had another one down here. Yep, reduce smoking in public areas. Control-C, go back over here, hit the plus button again. Control-V, save it. So now we have our three goals in there. If I wanted to enter the go to the objectives from here, this is where the drill down arrow comes in. So instead of me having to go up and click on reduce smoking in high schools and then hitting the tab, I can just go hit the little drill down arrow here. It took me to reduce smoking in high schools and the objectives for that. So let's go ahead and add the first objective in here. And we'll go back up to the top. So our first objective here is to reduce smoking at Wayne High School by 25% by the end of the school year. Control-C, go back here, Control-V. I'm going to go ahead and save that. Then we had a second objective, reduce smoking at Desert Vista High School. Control-C. Go back, hit the plus button, Control-V, and we'll save that. Okay, now back up to reduce smoking at Wayne High School. Several different options in here that we'll look at. First thing is you're going to assign an objective lead. So I'm going to click on the little drop down here. Nobody shows up in this pop-up. And the reason is because nobody is assigned to this little group that we just created, the tobacco group. So if I hit show all users, it's going to show me everybody in the organization here. So let's go ahead and just pick Crystal as our objective lead since she's top of the list here. Save that. So now Crystal is the objective lead. She has two responsibilities. Number one is to keep the information updated down here, which is our objective percent done, which I'll show you how we're going to change that here in a second. Secondly, her job is as the project manager, program manager, to get us to this 25% reduction by the end of the school year. I'm going to go ahead and save that. Now, what we're looking at here is a percent reduction and not a percent done. This is typically 0 to 100% done. In this case, we're going to say we want a percent reduction. So I just click on the title here, the objective percent done title. I'm going to go in here and put in percent, maybe, percent reduction. Our measurement units, which shows up over here, as you see, is percent. And then I can either count widgets, decimal, or I can do percent. In this case, we're going to go ahead and do percent. Widgets can be, it could be anything that you're counting. It could be number of tobacco vendors contacted. It could be number of training sessions, whatever. In this case, we're just going to say we're trying to reduce smoking by 25%. So I'll say percent. So now here you'll notice that we have percent reduction. And let's go ahead and change that to 20% for now. And we'll go ahead and save it. So that is setting up the objective lead, setting up our target down here. And then this is actually the field, if you're in this screen, to do the update. So you're going to find out somewhere that we've reduced smoking at Wayne High School by 22%. So you're going to go down and change this from 20 to 22 and save it. A couple other options I'll show you over here. And these are on the goal, objective, and activity screens. Number one is notes and comments. So I can just go down here and say, smoking was reduced by 20%. So that's kind of nice to know, but at this point in time, you don't know who put that comment in, when it got put in there, or anything else. So what you can do if you want to is you can go in here and hit the little button up here, and it puts in the date, the time, and then the username. In this case, system admin is me. So it's going to be in here. This is a date timestamp note. So you can date and timestamp your notes in here. And it's kind of nice because you get other people looking at this, and it's nice to know who put the tag in there that said it was 20% reduced and when did they do that. So then you can kind of calculate how we're doing in the program here. Now, something else that you might want is a data source. And the data source is, where am I going to go to get the information? In this case, the percent reduction at Wayne High School. Maybe it's, on the CDC website, maybe it's on the Wayne High School website that you can grab it. So to do that, I just click on this button down here. It says data source. So let's go ahead and say it's the CDC website. And then when I put in the data source link, just the only thing you have to remember is you got to put in the entire link down here. So it's got to be HTTP or HTTPS:// and in this case it'll be www.cdc.gov. And now, and I can have the whole string in here. There is actually a smoking cessation fast facts webpage on the CDC website. So you can go grab that, paste it into here, hit OK. The text description shows up down here, and then this little chain link button over here is my link. I'll go ahead and save it. This is my link to that particular website. So when I click on it, it opens a new browser tab up here, and it takes me right to the CDC website. So the reason this is in there is because I want kind of direct access to my point of reference for entering the information on this particular objective. And again, you can have these at the goal, the objective, and the activity level. So you have lots and lots of them in there. We use these in the accreditation plans. We link it back to the FAB documentations on their website. So you got a direct link to the FAB documentation as you're going through the plan. So this is our first objective. Again, we can go down and do the same thing to the second objective, but for now we won't go through that level here. So under the objective then, I'm going to go to my activities. And again, there's no activity in here to start with. So let's walk through the different types of activities and the different metrics and such here. So our first activity, you see it's designated as a project-based activity. That's just something I put in there. Create training content materials, Control-C, go back over here, go ahead and paste that in here. Oops. Oh, I didn't, I thought I put a space in there. Okay, there's three types of activities. Project-based, again, is by far the most common, then the quality assurance and the quantitative measurement. We're going to leave this as a project-based activity because creating training content would, in fact, be a project. Now, again, every activity's got a performance metric. This is the only one where you have to come up with a performance metric. So how do I know when I've completed this activity? Go back over here. It says training content materials have been created, basically. Control-C, go back over here. Control-V. So when are we going to do this? Let's call it September 1st through September 30th. And by the way, you can type in these dates as well as using the calendar to put them in. It's up to you how you want to do that. So our first activity then is creating the training content. And it's a project-based activity. So the next thing we're going to want to do is assign team members here. So I'm going to click on this little icon down here next to the activity leader and team members. Click on that. I'm going to go in here. Again, nobody's assigned to the tobacco group, so we're going to open it up to the whole department with the little black X up here. Open that up. So let's go ahead and pick a couple of folks. So Cassandra is going to be our lead here. So when I click on the lead column, to be a lead, you have to be a team member. And by default, you're going to be the email notification. So you're going to be the person who gets the real-time planning email to come back in and update this particular activity. You can also go in here and you can add team members, as many team members as you want. And you can actually have these team members get email notifications as well. Typically, you're going to have the team lead as the person who you want to do the update because they should be the most close to the project in this particular case. I'll go ahead and save it. So now what we have down here, we have the L indicates team lead. The blue around the L indicates email notification. And then the T obviously is team members. So these are the people who are going to be building the training content. The other option we have down here is to add external partners. I don't know if you guys have any partners in the system or not. Let's take a look. Nope. Okay, so down the left side here, you would have partner organizations. So you might have VMSG dashboard as a partner organization in here. Under the partner organization, you can have as many contacts as you want. So you could have Fred and Andrea and Abigail and everybody listed down here under VMSG dashboard. There's a green check mark over here that you can check that just says select this partner organization. And then you can, if you want to, you can go select the contacts within the organization. You can do either. You can just put in the organization, or you can put in the organization and the contacts. And then they're going to show up down there. You can have as many partners assigned to an activity as you want, and you can have as many contacts within each partner assigned. And once you guys get partners in here, it'll be easier to understand what that's all about. But basically, the external partners are the folks you're working with to create this training content in this particular case. So again, we're going to save that. So that's our first activity, the project-based activity. Now, the default down here is 0 to 100%. So how far along are we? Let's go in here and say, okay, I'm going to put in that we did so my mathematical brain can calculate that, says that's probably 25% done. So over here, I'm going to put in 25%. So maybe that's the first week of September. I got that part done. Then maybe the next week, I'm going to go in and say, okay, completed 2 of 4, and then this is going to be 50% done. I'll go ahead and save that. So you can see down here, you're putting in the notes. You're going to continue to go on through until you get to 100%. This is handy if you're doing this over a period of time. If you're doing this, let's say all in a couple of days or in 1 week, and you just want to go in and say, hey, I'm done, there's a couple of options here. So every activity's got this wizard right here. Click on that, opens up my wizard. I can put in the beginning and ending date here, or I can put it down here, identical, doesn't matter. But here's my data entry types. The default is 0 to 100%. Again, if you're doing it over a period of time, it's nice to keep track of that way. I also have the option of a yes, no. So some activities can be answered with yes or no. The other one is complete. So in this particular case, let's say we're going to be doing this all in a week, and I go to the end of the week, I just want to say, hey, I'm done with it. So I mark it as complete, hit the little save button here. So you notice my 0 to 100% changed to a checkbox over here. If it's unchecked, it's 0. If it's checked, it's 100%. So I'm going to go ahead and check this. And you notice when I do that on a project-based activity, it turns the traffic light to gold. Gold indicates successful completion. So if we're at 100%, we're successfully completed. When I go ahead and save this, it's going to change the traffic light up here to gold as well. So that is my first activity and the different options that you have over here, the 0 to 100%, yes, no, and complete. Let's go to our next activity now. So to get my next activity, I'm going to hit the plus button here, go back to our little document and grab our second one, which is that QA activity. Provide 9 training sessions each month on dangerous smoking. Control C, back over here, Control V. So we've got our 9 training sessions each month. We're just going to drop this down and call it a QA activity. When I do that, it automatically opens the wizard for us. So here's, you're going to select your frequency. So we're saying 9 training sessions monthly. So obviously the frequency is monthly here. And then a start date, we'll just go ahead and leave the start date as today. The green, yellow, and red. The green, in this case, we're going to say is 9 because we know that our target is 9 training sessions. And we're going to pick a number, it could be 3, it could be whatever you want. I'm going to go ahead and say if we only do 6, it's going to set it to red, which indicates then if it's between greater than 6 and less than 9, 7, or 8, it's going to be yellow. Then we're going to create a metric type down here that says training sessions provided. And when I save this, it creates my performance metric for me. Training sessions provided, measured monthly, green, yellow, and red. And then down here is where I'd be entering the number of training sessions that we did. So you notice the light turned red automatically because we have basically 0 in there. So it's underneath the 6, so it's there. If I put a 8 in there, let's say, the light turns to yellow because it's calculated based on we're between 6 and 9. I can go ahead and save that. So this is every month where you're going to go in and put in the number here. So let's go ahead and say that now I get to 9 this month. So I put in 9 here. Go ahead and say save that. We'll get this update start date. So this is the start date of the cycle. In this case, it's a monthly cycle. So what it's going to say is, do you want to update the cycle start date? Well, I finished it for the month, so I might want to actually do that. So I get the option to select a specific date or pick today's date, the current date, or just say no and don't update it. For now, let's just go ahead and say no and don't update it. So I've updated this particular activity. It's gone to green because we got to our 9 training sessions. Again, we won't go through this again, but you could add the activity team leads and team members and the external partners in here. You got the data source down here. So if you got a data source for the number of training sessions, I don't know what that would be, but you could add that down in there as well. So that's activity number 2, the QA activity. Activity number 3 then is our quantitative measurement activity, and that is to contact all 20 tobacco vendors. Control C, back over here, hit the plus button again, Control V. So we're going to contact all 20 tobacco vendors. We're going to call this a QM activity. So when I do that, again, it opens up the wizard. I got a beginning and ending date, so let's use the same ones we were using before. September 1st, it's right around the corner, and September 30th. Our target number. So in this case, we know that we're trying to get to 20, so that's pretty easy to figure out, 20 tobacco vendors. You can work on this particular activity in decimal or dollars. So decimal is exactly that. It's widgets. You're counting something in here, in this case, tobacco vendors. You can also use this type of activity to do financial calculations. A lot of people use it to manage grants. So these are dollars in, dollars out for grants, all that kind of stuff. Anything you want to do for dollars, basically. In this case, my metric type is going to be tobacco vendors contacted. A couple of values down here. I'll leave it at the default. Enter a value to add a total. I'll explain the other one here in a minute. I'll go ahead and save that. So it created my performance metric of 20 tobacco vendors contacted between 9/1 and 9/30/23. It put in the beginning and ending dates for me in here. I'm going to go ahead and save that. So now with the option, I selected a value to add to total. If I go in here, let's say the first week, and put in that we contacted 5 vendors, it takes it down to the summary total here of 5, calculates my percent complete of 5 divided by my target of 20, says we're 25% done. I go ahead and save that. The next week, I might want to go in and put in 5 more vendors that I contacted. Again, it's going to roll it up to 10, say we're 50% done, save that. So that's one of the options in here. Let's go look at the other options. The other basic option down here is enter a new total value. So what happens when I save this? You notice that the summary field goes away. So this is another one of those where I'm going to be contacting all these vendors this week, and I just want to go in and put in how many I did. I don't need to keep track of it every week. So in this case, I can just go in and say I contacted 20 tobacco vendors here, calculates it to be 100% complete, save it, we're all set with that one. There's one other option. It's kind of a little bit of a hidden option in here. And that is, let's go back and look at enter a value to add a total, and we're called a 0 target. So you don't always have a target quantity in here. So if I put in 0, watch what happens. Obviously, our percent cannot be calculated because there's no denominator. You can't divide 20 by nothing and get any number out of it. So what this is all about is if you have something you just want to track, how many are we doing? In this case, it was a department in Ohio who was doing plumbing inspections. And they didn't have a target number, how many they do. They just want to be able to respond within a couple of days and something along that line. And at the end of the month, how many did we do? So that's why we created the zero target. They can just go in here and say, we did 21 plumbing inspections this month, and it's going to keep track of it all the way through. So if I put in 5 more here, it's going to sum it up to 25. Again, it's not able to calculate a percent complete in there. So those are the 3 activities, the 3 types of activities, and all the different variations of the activity. So as you're entering a plan, the idea is, first of all, you're going to look at project-based activity. Secondly, if there's a quantity in there that you're working with, you might consider the QM activity. And if it's something that you're doing over and over and over on any frequency from weekly to every 5 years, you might want to consider the QA activity. So let's take what we just did and march it back down through the pyramid. I'll go down through all the levels here. Okay, so our group was Tobacco 2023. Underneath that, we had tobacco cessation as our initiative. Remember, we had 3 different goals. We chose reduce smoking in high schools. And as you're completing the plan, you'd have the reduce smoking in colleges, and you'd have a plan underneath that. You'd have reduce smoking in public areas, you'd have a plan underneath that. So the plan spreads out. That's why the pyramid. Then the objective we were working with is reduce smoking at my alma mater, Wayne High School, by 25% by the end of the school year. And then the steps we're going to go through to get there. So that's the operational planning process here. Every plan is exactly the same. And like I said, you're potentially going to see variations in the nomenclature, services, goals, objectives, activities. I don't think I've ever seen anything else at the group level up there, but it could be divisions or programs or something along that line. Now, that's pretty much what I had to go over today. What I would like to do is assign everybody a little bit of homework here. And the homework is very, very simple. I would like you to go in and create a plan. If you want to make it a fun plan, that's just fine. We've had everything from planning my kid's birthday to planting grass in my backyard to planning my Las Vegas vacation. You name it, people have been doing it. Or if you want to be, in the business here, you can take a plan that you already have in there, put it in the system or part of it in the system. But just do this. Just take under the training group, if you're going to create a funding plan or something like that, use the training group. Everybody's got full access to it in there. One service or initiative, one goal, one objective, and if you can, think about how can I use the 3 different types of activities. So do a project-based activity, a QA activity, and a QM activity. And then what we're going to do in the next session is we're actually going to go through and review those plans. So like I mentioned, I sent you the template in the meeting invite. So if you want to just do it in the template and not go into the system, great, no problem at all. If you want to scratch it on a piece of paper, no problem at all. If you put it in the system, we're going to go through and review it. We're going to walk down and kind of give you a little critique on it. If you just put it on the template or on a piece of paper, what we're going to do is give you control and let you actually go through and do the input of the plan right then and there. So that's the homework for next time. We'll set up an ongoing session. It's usually a pretty short session to go through and just review the plans. The idea here is to make sure that you understand the hierarchy here, the different levels of the plan. What's a goal, what's an objective. I can give you a hint where most people get messed up here is at the objective level. So think about specific, meaning you're going to do something like reduce smoking at Wayne High School. 25% measurable. That is our measurement in here. And when are we going to do this? By the end of the school year. So think about those things in your objective. And then the activities are the steps you're going to go through to get there. And again, if you can create the 3 different types of activities, that's great. Any questions?
I have a question. I was having trouble opening the Word document that was sent when the training sent out.
Really? Let me resend it. It may have got corrupted. That does happen in here.
Thank you.
Also,
yeah, it said something about a permission, checking the permission for it. Or no, it could be just my computer. So.
Okay. Do you have an account on the dashboard yet?
No.
I don't think she has an account yet, but
Can you send me her information? I'll get it set up for her.
yeah, we can do that.
Basically, I need first and last name, email address, phone number, what group she belongs to. In this case, probably the department, and who does she report to? If you send me that information, I'll get her set up. I'll email her back, and I'll send you that template as well.
Awesome. Thank you so much.
My pleasure. Any other questions? Anybody have any problems with doing the homework?
I think, I don't have any questions. Kat, do you have anything?
No, I don't have anything.
And by the way, if you already have a plan that you want to start entering, please feel free to do that. It's all I'm trying to do is get you hands-on in the system, understanding the different levels and understanding all the button pushes and the saves, everything you got to do to put it in there. And you'll find that once you go through that one time, it's a piece of cake.
Yeah, I'm thinking we're working on our health assessment right now, so I'm thinking maybe that's something that we can take a stab at and
Sure.
try to develop a plan for that for the next session.
Yeah, whatever you want to do. Typically, we put about a week in here because I know you guys have real jobs too to do. So we'll schedule. Do we have another follow-on training scheduled already?
I don't think we have one scheduled yet, unless that was scheduled with Crystal that I'm not aware of.
Let me take a look at the calendar here real quick and see. Okay, it'll probably be sometime next week here.
So a lot of us, or at least I'm out next week. And
How about the week of the 11th?
the week of the 11th, let me look there. Depending on the time that could work, that's a possibility, or the week after as well.
Okay, well, Monday is wide open other than 11 to 12. Wednesday afternoon is wide open. Friday is all day is wide open. So if any of those will work, why don't you take a look and get everybody together and then just send me an email with kind of what works in there. And it doesn't have to be next week, but let's, kind of keep the mind going here with what we've talked about today.
Awesome. Okay, great. Thank you. Thank you so much. I don't think I have any questions. Will you be sending out the recording link later?
Yes. In fact, thank you very much for that. I'm going to go ahead and stop the recording.